Hey guys, today we are talking about anxiolytics and hypnotics, right? So, so the word anxiolytics means those drugs which kills your anxiety, and hypnotics means those drugs which induce hypnosis. Now, the word hypnosis means sleep, right? Now, here you have to know a lot of things that at first you must know about the GABA receptor. GABA receptors are two types: GABA A receptor and GABA B receptors. GABA A receptor is chloride ion channel. As you know, the chlorides causes hyperpolarization of the neuron, and that causes the neuroinhibition. Right now, you must know about the structure of the GABA receptor. So it is made up of 5 subunits. So the GABA A receptor is made up of 5 subunits. Right. So this is the channel, and these are the units: 2 alpha unit, 2 beta, and 1 gamma. Now this is alpha, beta, alpha, beta, and the gamma. Right now, between alpha and beta, there are sites for binding of GABA binding sites, and between alpha and gamma there is a site for binding of benzodiazepines, right? And the beta unit have the barbiturate binding sites. Now when two GABA subunits binds to its receptor, I mean to its sites, then the closed chloride ion channel becomes open. This is closed by the projection of alpha subunit, right? Like this one, there is some projection from alpha subunit that closed the ion channel. Now when two GABA molecules bind to its receptor, to its site, these projections are the chloride ion channel becomes opened, right? Now the benzodiazepine binding site has agonist, which is benzodiazepines, and antagonist, that is from xenyl, and inverse agonist, beta carbonate. Now, the actions of benzodiazepine and barbiturate on the GABA receptor. As benzodiazepine causes increase in frequency of opening of the chloride ion channels, right? And barbiturates cause increase in duration of opening of the chloride ion channels. Now coming to the benzodiazepines, these are classified according to their metabolism to their metabolism. Some are by phase 1, the phase 1 metabolism by the CYP3A4 enzyme, and phase 2 by glucuronidation. Also here the phase 1, that is CYP3F4, but the phase 2, there is faster glucuronidation. Right, it's not normal glucuronidation, this is faster. And in the third one there is no phase 1 reaction, only the phase 2 reaction, that is the glucuronidation. Right, you know about these things. Now, as there is, we can classify this according to their duration of action. As it is faster glucuronidation, right, faster glucuronidation that causes, this is the shortest acting drug, right, shortest acting, and there is no glucuronidation, and there is there is no phase 1 reaction, only the phase 2 reaction. So this is the short acting drug, like, right, and this is the longest acting benzodiazepines. Now you have to think of some situations I'm giving you right here. Do you know, or can you tell me uh, about out of these drugs, out of these three categories, which one should have minimum dependence and which one should have maximum dependence? Guys, dependence is something that is caused by I give you an example. This is the receptor, and think this is the dopamine receptor, and this is the dopamine. Now when dopamine comes continuously, right, for a very short time it acted, and it metabolized. If it is very short acting drug, and it is like a striking and then metabolize, striking again, then metabolize, then what happened, these receptors gone down regulated. The receptors on the cell surface, right, the receptors on the cell surface, it becomes internalization. This is known as down regulation of receptors, right, down regulation of receptors. So that is why low dose of dopamine is not sufficient to produce that much of effect which is produced previously with the same dose of dopamine. So this is known as dependence, right? So here the shortest acting drugs, the shortest acting benzodiazepines causes maximum dependence, and the longest acting or long acting, basically, they produce minimum dependence. So that is why the long acting drugs are used in case of alcoholism, right, alcohol dependence. And as you know, here there is no phase 1 reaction, so this is safe in the liver failure, right, liver failure patient is safe used to. And now coming to the examples, the long acting drugs, there are drugs like diazepam, clonazepate, chlordiazepoxide, and like this, the shortest acting drug like triazolam, midazolam. These are shortest acting drugs. Among this, midazolam is uh, more shorter than triazolam. And the short acting drug examples are like lorazepam, oxazepam, temazepam, and estrazolam. these are the examples. Now come to the uses. Right. So as you know, they cause the neuroinhibition. They can be used in case of epilepsy. Right. Like I'm just talking you. Diazepam, lorazepam. These are used in status epilepticus. Right. Clonazepam. Clonazepam used. It is used in case of juvenile myoclonic epilepsy, absent seizure, and infantile spasm. The clonazepate used in case of partial seizure, right? Clobazam used in case of Lennox-Gastaut syndrome, Dravet syndrome, and rectal diazepam used in case of prophylaxis and treatment of febrile seizure. Right. Now midazolam and clonazepam, they can be used in case of crescendo seizure. Now flunitrazepam, this is the testless benzodiazepine, right? So this is used, I mean this is misused in case of date rape because it is tasteless, so it is poured into the drink and it is misused. Okay. And roofie, it is called roofie, which is mixed into the alcohol, right? So the second use, that is in insomnia, we can use triazolam, temazepam, right? Insomnia. And in case of alcoholism, right? Alcoholism, the all long acting drugs are used. In case of alcohol withdrawal seizure, we can use diazepam and lorazepam. In case of anesthesia, right? Right. So in case of anesthesia, we can use lorazepam, diazepam, and midazolam. And in case of analgesia, we can also use midazolam, right? Midazolam, that is the shortest acting benzodiazepine. We use this intrathecally, analgesia. And the muscle relaxant effect, the diazepam also has the muscle relaxant effect, right? Now the side effects. Now the side effects of benzodiazepines include the CNS suppression, right? Suppression. It causes ataxia, it causes confusion, it causes anterograde amnesia, right? And partial seizure, I mean paradoxical seizure. And diazepam causes coronary vessels dilation, right? Clonazepam causes nightmares, and the triazolam causes behavioral normalities. So this is the very first video of mine, right? So we covered the benzodiazepine. We have to cover the barbiturates and other drugs that is used in case of hypnosis and anxiolytics, right? So one thing you have to know, another thing here, that is what is mean by sedation. And hypnosis means sleep, but sedation is not sleep. This is basically the decrease in alertness and awakeness, right? Decrease alertness and awakeness. So this is sedation, and this is also called sedation. So this is the part 1 video. The next part will come very soon, right? So thank you guys for watching this video.